Inside the stories that affect you. This is Inside KELOLAND.
Good evening, I'm Bridget Bennett. Thanks for joining us tonight. Coming up on Inside KELOLAND, we talk with doctors from Vera and Sanford as we update you with the latest information on the spread of COVID-19 in South Dakota as cases spike in other parts of the country. Plus, the pandemic has forced many events to move online, including South Dakota 4-H. How this organization is still offering some opportunities for kids all over KELOLAND. And we're continuing the conversation on race relations in South Dakota as we talk with people of color about the stereotypes they continue to face. We begin tonight with an update on the COVID-19 pandemic in KELOLAND. Joining us now via Zoom are Dr. Susan Hoover with Sanford Health and Dr. David Basil, the Vice President for Clinical Quality for Vera Medical Group. Thank you both for joining us today. This question we're going to start with is for both of you. Cases are spiking in other parts of the country, but what is South Dakota seeing right now as far as our rate of cases? Dr. Hoover, let's start with you.
Our rate of cases remains relatively steady. It definitely has gone down from its peak, which was about 6 weeks ago. However, we continue to see in the double digits of new cases diagnosed every single day in South Dakota. So I'd say we're in a steady phase, but the pandemic is definitely not over here.
Yeah, Dr. Basil, same question. What are you seeing out of Vera as far as cases?
Yeah, I would agree with that. About 6 weeks ago, it seemed like we saw a peak and then came down to half or 2/3 of that peak. But then ever since then, for the good last 4 to 5 weeks, we've been pretty consistently steady. And so I was expecting that we would see it tail off a little bit more than it has. And certainly it's been gradually maybe dropping just a little bit, but we're not through this yet by any means.
Now, a big topic of discussion we continue to see is whether we should continue to wear masks. What do you say to people who don't want to keep wearing masks out in public? Dr. Basil, let's start with you.
Yeah, I get it. I mean, we're in the middle of summer and it's hot out and it's not always comfortable to wear a mask. I totally understand where that's coming from. But like we said before, the numbers have not dropped off, totally down yet. And the masks are still the single most effective way we have to combat the spread of this. And so anytime you're going to be in an area where you can't adequately social distance and put yourself and others at risk, masking is still the best bet. So I get how uncomfortable they can be, but they're effective.
Yeah, Dr. Hoover, how is Sanford working to try and encourage people to keep wearing masks right now?
So I agree with Dr. Basil. We're getting a little bit of fatigue with a lot of the COVID-19 precautions, including wearing masks. And at Sanford, we still very strongly encourage the public and our patients and guests to wear masks. And we actually require it of our staff to wear a mask at all times within the healthcare facility. And we just the other day had a memo go out kind of cheering on our staff and reminding them that we're not through this yet and they need to continue wearing masks.
Now, another area where some people might be getting some fatigue is staying out of those big crowds. Should people still be watching how big of crowds they gather in and making sure they're social distancing as much as possible? Dr. Hoover, let's start with you.
Absolutely. We're learning more and more that the risk of spread is really in large gatherings of people in close quarters, especially indoors, especially where there may not be good air circulation or frequent air exchanges. So that is exactly the situation in which transmission is most likely. So staying out of large gatherings, especially indoors, I think is one of the most important things you can do.
Yeah, Dr. Basil, what would you like to add?
No, I would totally agree with that aspect of it. It takes kind of prolonged close contact for COVID to spread, prolonged being like 15 minutes. And so anytime that you're going to be somewhere where you can't keep that social distance, where you're unable to get the breeze blowing through adequate air exchanges, that's when the risk goes up. And it's all those sorts of activities that we all enjoy so much. We've been craving all this social interaction, getting together with families and friends. And so especially as we go into the 4th of July weekend, there's going to be a lot of events and stuff. And as many of those as can be outside, spread out, fewer number of people, the lower the likelihood that something's gonna spread in that situation. If you have to attend an event like that, wear your mask. I encourage others to do so the same.
Another big question is when we'll get a vaccine. What are you hearing about when a vaccine might be available? Dr. Basil, let's start with you.
Yeah, so I think vaccines are still a little ways off yet. So we've got at least a couple of them that are just going into phase 3, which is kind of the final phase of study trials, anywhere from 20,000 to 100,000 individuals that will be enrolled in a couple of those front runner trials. But those trials will go on into the fall because there's a big difference between some of the trials for like remdesivir, where you're giving a drug only to somebody who's really sick and you're trying to save their life in the moment, versus giving a vaccine to a large number of people that aren't sick. And you've got to be a lot more careful about safety in that situation. And that just takes time to be able to prove safety and efficacy. And so it's going to take a little bit of time to prove that safety and efficacy. And then you've got to ramp up the whole production machine. And then that's going to take time. And so in my opinion, that's going to be early next year at the very earliest, if not, a year on past that. So I think it's a ways away yet.
Yeah, Dr. Hoover, anything else you're hearing about a potential vaccine?
I agree completely. We cannot count on it as the very next thing that's going to happen to save us from COVID. It's a ways down the road. And like Dr. Basil said, when we talk about vaccines, we have to talk about safety first and foremost, because this is something we're giving to large numbers of healthy people for prevention. So it needs to be even safer than any drug or treatment we might propose. So I think there's an enormous effort going on right now. It's the biggest I've ever seen, I think, to develop a particular vaccine quickly. But it can't be rushed, and we can't count on it being available in 6 months or 12 months.
Yeah, and another big question a lot of people are having right now about COVID is the back to school question now that we're in July. Have you guys been working with a lot of school districts in the area, and what are your thoughts about going back to school and what that could look like this year? Dr. Hoover, let's start with you.
So school is very important. I think it's the closing of schools was not done lightly. It has many consequences. School has many benefits for kids and families and society. So I think it's something that ought to be considered very carefully. Reopening school is different from reopening parties and bars and other things that are a little bit more optional. So I think it ought to be deeply considered by everyone who has something at stake in that, which is basically all of us.
Yeah. Dr. Basil, your thoughts on how to safely open school if that is what is going to happen this fall?
Yeah, I've seen multiple school districts across the state and the area that are having a lot of those discussions and reaching out to all of the health systems in their area to have just those discussions. And I agree, it will be, if at all possible, I'm a pediatrician and kids need to go back to school. There are so many benefits socially, educationally, everything about being in school. So if it's safe, we need to work towards that ability. If it's not safe, it's not safe. But that is certainly the goal. And I'm very hopeful and optimistic that we'll be able to get back there this fall.
Well, thank you both very much for giving us that update. A lot of questions people are still interested in. We do have to take a quick break now, though, but stay with us. We'll be asking the doctors from Avera and Sanford more questions about the spread of COVID-19 in KELOLAND. That's coming up right after the break. Good. We'll be right back with you guys. What you can't see is that I am wearing flip-flops and I did not put my nice shoes on, and they have been caught on camera a few times. Oh, well, it's fine. Oops. Oh, well. Okay. I didn't ask a question that we're going to be asking, did I? Okay. Cut. Doctors, we're just about ready. Stand by here. Welcome back to Inside KELOLAND. We've been talking with Dr. Basel from Avera and Dr. Susan Hoover with Sanford for the latest on the spread of the coronavirus in South Dakota. And many businesses and workplaces are starting to welcome customers and employees back. So what safety measures should they all be taking? Dr. Basel, let's start with you.
So just similar to the general public, it's all about avoiding close extended contact between your employees and your customers. So any type of activities that you can do to spread people out, reduce the time that they're in close contact. So, in our organization, we're working from home as much as we can, as much as that makes sense. When that doesn't make sense, we're trying to limit the number of people in a given space, making sure that they're wearing masks when they are in areas where they're near each other, making sure that we're looking at airflow in all of our buildings to try to get the air exchanges as quickly as possible, and all of those sorts of things that reduce the contact time with potential infectious particles. Here at Avera, we have a kind of a business toolkit that we are giving away to anybody that's interested. You can go to the avera.org website and has pages and pages of recommendations that we're happy to share.
Dr. Hoover, what advice is Sanford sharing to stores and other businesses as people start to go out again?
So similarly, we're working with some local businesses as well in providing advice. The mainstay is probably avoiding what we talked about before the break, which is large gatherings of large numbers of people indoors with poor ventilation. So the more that you can do things outdoors, if your business is the kind that can do that, or limit the number of people in your space, either by physical distancing or people attending virtually. And then to think about the consequences of what you're doing. So if you're limiting the number of people in your store, that's great. But is there a crowd on the sidewalk waiting to get in? And how close are they to each other? And how are you managing the line? Things like that. If you can at all encourage your customers or clients to wear masks or even provide them, if you have the opportunity, that is also helpful.
Now let's talk about another one. It's summer, people are ready to travel, but advice you have, Dr. Hoover, we'll start with you. Can people start traveling to other states or even other countries right now?
To a limited extent, yes. And I think it's really good that people are thinking about this, that they're not just going. The CDC website has some excellent advice geared at the public about travel, both within and outside the United States. So a couple of the things they suggest that we think about are exactly what we've been talking about in this segment. How close will you be to other people when you travel? Will you be in an enclosed space with especially large groups of people? Where are you going? Is it a place where there's a lot of COVID spreading right now, where the cases are going up rather than down? Who are you visiting? Is it people that might be more vulnerable than yourself in terms of age or medical conditions? And what do you have to do when you get back? Do you have to go right back to your job? Are there going to be restrictions on your coming back to work? Do you have a plan for what you will do if you do get sick? So I think travel is possible, but it's not possible without some thinking and planning and really considering how necessary is this trip and what are the risks and benefits.
Some good information. Dr. Basel, what advice do you have from Avera for people who are thinking about traveling now?
I think that's wonderfully stated. And so even the mode of travel is another thing to think about. Airfare, by definition, you're kind of in an enclosed space a little bit, but the air handling system on planes isn't terrible. And so it's, again, going back to that risk-benefit evaluation. How badly do I really need to travel by air? Is it something that I can go safely by car and not add too much extra time to that? I think we're seeing a lot more travel closer to home via car, a lot more people going out to the hills or to a neighboring state by car. We're seeing a lot more of that. But even from that situation, paying attention to what sort of congregation are you going into? How are you going to be protected? And I think your point about who are you going to expose that may be more vulnerable from you once you get there is an important point not to lose sight of, because a lot of times it's not about you, but it's about maybe your parents or your grandparents that you may be going to visit or going along with.
Some very important things to think about. Thank you both for the great information and for joining us today. After the break, we'll talk with South Dakota 4-H about how it's still offering events for kids virtually. We're going to be right back after this. Welcome back to Inside KELOLAND. The coronavirus pandemic has canceled or postponed thousands of events all over the country and here in KELOLAND. It's also impacting how South Dakota 4-H operates. Joining us now via Zoom is Tim Tanner, the director of the South Dakota 4-H program. Thanks for joining us today, Tim.
Thanks for having me.
Yeah, now definitely not the typical 4-H summer that so many kids in KELOLAND are used to. Tell us every way the pandemic is impacting 4-H over the summer.
Yeah, in many ways, it kind of feels like a tale of two summers for us in 4-H land, where we started off planning for everything to be virtual because we thought that that's where things were going to be all summer long. And now more recently, we've been given the green light to kind of open up on a limited basis and begin restoring some of our in-person activities as well. So it's been a busy summer and excited to support 4-H throughout.
Now, some of the main 4-H, the thing that so many look forward to is that county fair every year. But a lot of them, have already canceled. What does that mean for a lot of our students this year?
Yeah, from what we're hearing, maybe 1 out of every 3 across the state are canceling. We are having some replacement 4-H activities in some of those counties. But you're right, that county fair, county achievement days experience is kind of the frosting on the cake for our kids. They build that cake all year long, and they like to, we all like the frosting on top, right? And so it's a showcase opportunity, and we're thankful that in many cases things were able to go forward.
And what about some of the other 4-H activities that you have throughout the summer season, your usual events? Are any of those going on outside of the county fairs?
Yeah, a number of our statewide programs that were offered would normally be offered in the early part of the summer were postponed or canceled. We are still going to be able to offer rodeo, state horse show, our state dog show, and things like that towards the late summer. But we've been really pleased with the turnout for our Summer Adventure Series, which is an online virtual platform. We're right at the midpoint of that now, and we've had over 1,500 people register for that to participate throughout the summer. And it's a week-by-week process as well. So youth that are still interested, there's still some great opportunities over the last 5 weeks to get involved virtually as well.
Now, how about in their local communities? How are you keeping those kids locally staying involved in their community?
Yeah, absolutely. The youth have been very involved kind of on an individual basis until we got the green light because we didn't want them coming together. So a lot of focus on that community service piece, building, making masks for individuals, handing out food where it was safe to do so, and those types of things. And now as we, go back into kind of the live programming era here, they'll begin to resume those opportunities for club programs and the other things that they know and love.
And talk about next summer. Are you already kind of planning ahead for what next summer might look like?
Yeah, I don't think any one of us really wants to think about this lasting that long, but we have been building kind of our plans in such a way that they'll be readily transferable in future years, if we should need to use them.
All right, Tim. Well, thank you so much for your time today, and I hope it's a good summer for you and all the other 4-Hers out there.
Thank you so much for having us.
Yeah, still to come here on Inside KELOLAND. Expanding the diversity of a police force is essential for communities, but not always easy.
In the post-Ferguson era, it became especially challenging to get new police applicants, and not just here, across the whole country.
The efforts being made to encourage more people to join the police force, that's after the break. Welcome back to Inside KELOLAND. Right now on social media, many Black people are sharing stories of the discrimination they've experienced throughout their lives. South Dakota is a predominantly white state, so people of color are often seen as different from a young age. KELOLAND's Lauren Solik tells you the stories of stereotypes placed on 3 people of color who grew up in South Dakota.
Stereotypes can be painful and insulting.
I'm not a drug dealer.
I'm not savage.
I don't think that being a Native American is a burden at all.
I don't hate white people.
The United States Census Bureau estimates that as of July 1st, 2019, 2.3% of South Dakota's population identified as Black or African American.
My grandmother was white. My mother was a light-skinned woman. My dad is African. My grandfather on my mom's side is also black. So it's like I had a very integrated family. So I've just seen people.
9% of South Dakota's population is estimated to identify as American Indian and Alaska Native.
I remember specifically about probably the 4th grade, I want to say, was about the first time that I shared with my classmates my Native American culture, and it was just something simple. It was my Native American name, I suppose, which is, people kind of joke about, but it was really special to me. And so I wrote it on the board when everybody went to lunch, and then I remember when they came back, it kind of became a joke, almost. And I learned very quickly, really, just to not share that kind of information anymore.
2.5% of the state's population is estimated to identify as 2 or more races.
So my father is Vietnamese, and he came from Vietnam when he was around 18 years old. And my mother actually grew up on the other side of the state, on the reservation. So I'm half Vietnamese and half Native American.
Soleil Bachale has felt what it's like to be racially profiled.
I was arrested with my friend when I was 18, and they brought us in, same charges and everything, 2 different sentences. My friend, who is a Caucasian male, and I hung out with him earlier this week, I love this guy. He got a diversion program, a fine, and a slap on the wrist. I was offered 5 years in prison for the same thing. I was like, what? And I also was denied my Miranda rights. So when I tried to bring it up to the judge, he didn't even look at me in the face. He just kept talking over me.
Tristan Chasing Hawk says he has seen the biases placed on Native Americans because of movies and television shows.
Even though in South Dakota, where we live close to Native Americans because of reservations, because of high populations and things like that, I don't know if that necessarily is a benefit for people if they're not willing to interact with those communities, kind of thing. So instead, what's happening is they're getting bias perceptions and then are applying these bias perceptions without really ever updating them, if that makes sense.
Shandi Wing has heard the differing opinions of her ethnicities.
It's interesting because Asians are looked at as a model minority, quote unquote, and Native Americans are not, and along with a lot of other races in America. There have been some times where I've experienced people saying that my native side is kind of a burden to me just because I'm half Asian.
Despite the stereotypes, Bachale, Chasing Hawk, and Wing have learned to accept themselves and be proud of who they are.
I make music, I DJ weddings. I love DJing weddings, even if I'm the only black guy in the room. I've grown an appreciation for country music, not all the way, you know what I'm saying? I love Sioux Falls as a community. I ride my bike everywhere. I love talking to people.
Regardless of if I'm on the reservation or in an urban setting or in a school setting, I exist in the modern world and I am here. I am idle no more.
I am proudly Vietnamese and Native American, and I take pride in both of those cultures and educate myself about both of those cultures.
With Eye on KELOLAND, I'm Lauren Solik.
This group also gave their views on the Black Lives Matter movement. You can find out that story on KELOLAND.com right now. And since the death of George Floyd under the knee of a Minneapolis police officer, police and community leaders across the country have had some conversations on racism too. It's been a topic in the Sioux Falls Police Department for years, as the city has actively worked to recruit more diverse officers to the force. But now the police chief has set a solid goal to increase diversity on the SFPD.
I've set a goal of 20% of every new recruit class going forward. I want to see officers of diversity be at least 20% of those classes. And over time, hopefully we will get up to those numbers where we truly reflect the community that we serve.
You can look at the department's diversity numbers right now and how the department hopes to reach its new goal in this story online right now at KELOLAND.com. Well, that is all of the time we have for this week's Inside KELOLAND. Be sure to join us every Sunday night following the late local news to see what's going on inside KELOLAND. Have a great night, everyone.